Hi, everybody.
Hi.
Hi, Paul.
So we'll start in about 1 minute, unless either Commissioner Mudge or Kaylee or someone else says we should delay longer.
Looks like Kayla's getting on, and Mark is here, I believe, at 4100. Oh, that sounds good. Mike, how are you?
Spectacular.
Thanks for being with us.
Absolutely. All right, it's 1 p.m. Is that good for everybody to start?
That's good for me.
Okay. So I'll just do a brief introduction, and then Christy's going to share out her screen, and that'll be our presentation. So I just wanted to say this will probably be one of many presentations that we'll probably do, and some that Christy will do. But I do want to say this is our best information in a point in time, and as you might imagine, this is a rapidly evolving situation, both from a COVID-19 perspective, but also just in terms of resources that are available. As an example, just the end of last week, individual assistance specifically for crisis counseling was approved. And since that wasn't something that had been communicated by FEMA or anybody else, the state as well as people like Sol Vista are scrambling to figure out how to implement those type of services. So this is a point in time. Certainly things will be updated as we get more information, and we left 10 minutes at the end of this for all the types of questions that you might have. Having said that, I'll let Christy share out her screen. I think most of you know her, but let her introduce herself.
Hi, everybody. It's nice to see you. Yeah, so and we might even have more time at the end. I don't need to take up all of your time. I know that some of this information you've already received. We're trying, like Mike said, this is we're constantly changing our presentation, changing our approach to make sure that we are providing for y'all what you need. Each of our communities are kind of in a different place in how they're approaching recovery. Some of you have systems in place already, recovery teams in place. Others are still trying to figure out, what that looks like for them. So, as we kind of move through these presentations and make sure that we're adjusting for all of you, just know that even, yesterday when Mike and I talked about this presentation, you might already have different things that have come up that you want to talk about. So this is really just a template for our discussion, and we want to make sure that you all know, even though I can't see you, but if you want to stop me at some point in this, we can definitely stop to have a conversation while we are going through this. So feel free to do that. I'm assuming you all can see my screen. Has Buffalo on it? Awesome, thanks. All right. So we're just going to kind of cruise through this a little bit and see where we can land. So as you all hopefully know at this point, DOLA's role in disasters is really to partner with you, to support you in what you need. So we want to make sure that we are providing to you all the most up-to-date information that we have available to us, that we are understanding what your needs and wants are in your communities so that we can find the resources that you need. We're not here to tell you what to do. We're not here to make you do something. We want to provide best practices and information to you to help you as leaders, both elected officials and department heads and other community partners make the best decisions for your community moving forward. And so that's really what we are here to do. So just thinking about what the cycle is of disaster response and management. Disasters happen at a point in time, excluding probably this pandemic, but in our communities, through our emergency managers and other partners, we are hopefully thinking about what kinds of disasters might take place in our communities, understanding how we might mitigate for those disasters, preparing for them. Then we respond to them if they do happen, and we recover from them, and we learn from the response and recovery how we might better mitigate so that those disasters don't take a toll in our communities the way they did. So when we think about mitigation measures, we want to look at where we might be able to find the tools within our communities to help us mitigate, right, for those hazards. So our comprehensive plan or master plan might identify hazards, analyze the risks within our communities, help us set up policies or regulations within either our land use codes or our policy documents as an organization, so that we can start thinking ahead and how we could prepare for that. There are also opportunities to plan for resiliency, which goes beyond mitigation and preparedness to really look at what some of those causes are that underlie the hazards and vulnerabilities within our communities. So it's more of a holistic approach. And I think that this is really what we're looking at with the current COVID crisis, looking at how we can link together our environmental, social, and economic sectors to really make our communities more resilient as we emerge from what we're going through at the moment. So we move into emergency preparedness and management. So we want to have those plans in place that really protect the lives of those in our communities if and when a disaster occurs. And we turn to our partners, both at the local level as emergency managers and at the state emergency management office, DOLA, and others to really help us prepare for that. We respond to those disasters, and then we look at who within our community might assist us in recovering from a disaster. So before 2013, the Department of Local Affairs regional managers really assisted communities with short-term recovery, identifying those resources and trying to pull all of that together with our partners at DHSEM in the field. After 2013, after the floods in northern Colorado primarily, the governor's office created the Colorado Recovery and Resiliency Office to help manage that recovery process. When the CDBG disaster recovery funds came to Colorado, it was really important that there was a coordinating agency to help DOLA, DHSEM really prioritize and expedite those funds out to communities to get that work going. In 2019, the statute was changed, and the Colorado Recovery and Resiliency Office, now the Resiliency Office, was placed in the Department of Local Affairs. And by statute, they're responsible for long-term recovery and resiliency within communities. So what does that mean? How are they responsible for that? So two other groups were set up in the same year. The Colorado Recovery Task Force, which is run through DHSEM. Jim Raymond is the state recovery manager, and he brings together agencies across the state within that recovery task force to really help local governments understand, or communities understand, what their priorities are, ensure that government agencies are coordinating and collaborating to bring resources to those communities, to provide technical assistance on reimbursement processes, to assist in the recovery support function for community and economic recovery. So technical assistance from DOLA and OEDIT, developing best practices practices for communities, and then in the end, kind of advising that long-term recovery working group on what those priorities have been as identified by local governments, and really setting up what the processes can look like in the long term for communities. So there's more of a robust, I don't know, partnership or programming for recovery at the state now with the Resiliency Office and through DOLA and DHSEM. And we're seeing, obviously, in the current situation that we're in, how our partners at the Office of Economic Development and International Trade are also really ramping up that recovery effort as well. So first, I want to talk a little bit about some short-term considerations that I think you all are starting to move forward on at the moment. So in the past, after a disaster had occurred, the county commissioners could reach out to DOLA and ask for assistance in setting up a disaster assistance center. And this generally took place in a community center or a gym. It was on site, and we at the state really brought together resources for the locals. It was a one-stop shop, one place where community members come in and get information on a variety of topics, whether it was insurance or working through the permitting process at the county level. But obviously, for a variety of reasons, that physical in-person disaster assistance center cannot happen. First of all, there are not enough resources, physical bodies in the state to come set up in 64 counties. And with the social distancing and health issues that come along with this pandemic, that it's obviously not feasible. So we've been working with you all to set up virtual recovery resources, whether it's on your website, making sure that people are getting directed to the appropriate state webpage for that type of information. But even if we're in a virtual world now, as we move forward into the summer and into fire season, you all should be thinking about what happens if there's a physical disaster in your community. Can we set up a physical emergency operations center? Is there space where people can safely be in the room together? Same with a disaster assistance center. Can your community handle something coming up that would physically impact your community? So hopefully you all are starting to think about that as well. Your local emergency declaration, how long should you keep that in effect? You haven't let it expire yet. If you're thinking about how long it should last, right now it provides powers and authority that you normally don't have maybe. So is there an advantage to maintaining that declaration to speed up your recovery efforts moving forward? So having that discussion on what that might look like. Your plan for returning to work. So these next two bullet points are really about how you might be engaging your employees. So your plan to return to work and opening your facilities at the county level. And I'm assuming I'm sorry, I didn't look. I'm not sure if anybody from the city is on this or if it's just county, but City Hall, the county, any other government facilities, that plan to return to work should be based on the modeling that you're seeing, and you should be thinking about how you might be ramping up or ramping back down your employees who are on site and what the services look like for your community if you need to kind of re-engage some virtual working. So your employees are really, especially your first line, right? Your frontline employees, those who are dealing directly with citizens right now, should really be engaged in how that will look like to reopen, or what the offices look like. What do they need there? There additional hand sanitizer, making sure that there's extra paper towels in the bathroom. If you've gone to completely air dried drying system in your bathroom, maybe you want to put some paper towels in there so that people aren't touching door handles as they leave those facilities. Do office desks need to be moved farther apart. So making sure that you're engaging your employees because they can really tell you what they need to feel safe within their working environment. So I know you all have appointed a recovery manager, and we're going to talk a little bit more about that as we move into the presentation. So having a focus of that recovery manager on making sure that they're engaging with the resources available at the state level and at the local level. You might find that you need someone who is focusing on some economic recovery issues that you want to look at in the county, but also other recovery issues, behavioral health issues. As people start coming back together, how will lifting some of the restrictions affect some people? What are some of the implications within your organization that a recovery manager might need to look at if we're talking about different revenues and expenditure streams? So that recovery manager may need to be looking at a lot of different facets of recovery in your community. And so identifying maybe some subcommittees, and we're going to talk about that a little bit, so that there's some focus to your recovery moving forward. Making sure that you have your financial team, your grants team together to ensure that you're receiving all of the types of reimbursements that you could possibly be eligible for, particularly FEMA PA, which Mike's going to be talking about. These are complicated programs, and so having your finance staff involved in the very beginning is going to be really important as you move through and being successful with that. I'm going to stop. Are there any questions right now that you want to talk about, or should we get through the presentation and? Okay, we'll keep going, and then if something comes up, you can stop me. All right. So we traditionally think of disaster recovery as physically rebuilding something or replacing infrastructure within our communities. Fire, flood comes through, some other natural event, and we need to fix our roads and replace our bridges. But this is what we're going through right now, has us thinking about how we look at all of the systems within our community, I say not just our infrastructure. I don't know if we need to be thinking about our infrastructure much at all at the moment, but our social system, our public health systems, our economies are all at the forefront right now. And we can't just expect that we will be able to hit a reset button and go back to the way things were. We're looking, 12, 18 months down the line until maybe we start feeling even better about being out in our communities. So when we talk about recovery, we need to think about how our communities are kind of reshaping themselves, or how we need to help our communities reshape as we move through this. Economically, absolutely, but also culturally, environmentally, in a healthy way. And I know that we're probably all going to be tired of hearing the phrase adapting to the new normal, but it's something that we really, really need to be thinking about intentionally as we move forward. So your recovery team is being formed now. So you've identified a lead recovery manager, right? We have Janine has been identified as a recovery manager. So Janine, can you talk a little, do you want to talk a little bit about right now about the process that you've been going through to engage stakeholders and building out your communication plan? Or is there something here that we need to make sure that we're helping you with?
Yes, there is.
Excellent.
So we are a week into it, and I would say we have some rough ideas. I'm hoping by this Thursday's recovery meeting at 3:30, we'll have a draft of committee structure with some folks potentially identified for each of those committee structures. I'm not sure if we're going to be ready to identify folks yet. We need to decide on the structure and then see, where those best fits are for committee leads, committee chairs, and who will work on that. We are collecting data. So we just did, there was a great survey that was done in the business community around needs and impact. And so that is really helpful. We have some data collected from the disaster assistance portion that we've been providing to individuals through Disaster TANF and local community foundation. So we've got sort of some good economic information based on that. The other piece that we're really focusing on is regional collaboration. I was on a phone call this morning where we talked about the fact that really our economic recovery is very linked and tied to the economic recovery and the decisions for reopening that are made in Eagle and Summit counties. So that has a big impact on employment factors in our community. So really we're gathering information, we're gathering data, we're looking at structure and formulating ideas. And I think by the end of this week, we'll have a structure, we'll have potentially some committee chairs in place, and we'll have some next steps, and we'll set up a regular meeting structure, probably brainstorm. The other thing that we're doing is spending some time doing a hot wash or a debrief on what has worked well about our individual financial disaster assistance process. We've been able to help over 100 households with about $130,000 in assistance right now.
Awesome.
And so what we've learned from that process that we want to apply both in philosophy and tactics to the recovery process.
That's great. So what subcommittees have you identified?
So we've thought about a range of them. I was just sort of brainstorming, and I know Sarah has some thoughts on this too, keeping it as simple as possible. We do not have multiple foundations and community funds in our community to head up this work.
Right.
We don't have a director of an EDC, we don't have a county manager. So, recognizing the capacity that we have, thinking about committees, about 4 or 5 of them, one being health and safety, and one being mass care, one economic recovery with a lot under that, and then government collaborations, IGAs. It could be that there's another one to come about as well, but the economic recovery would incorporate the business community, special events, recreation, employment forecasts, and picture government budgets and the funding stream. I think that government budgets and the funding stream is really critical because as you said, Christy, we have to identify everything that's available out there to us right now and go after it funding wise if we're going to be able to do any of the work. I think of it as like we're all in boats and we have holes in our boats and we've got to plug the holes.
Yeah.
And then, so we got to find everything we can to plug those holes, and then we're going to work on rebuilding the boat. A bigger boat we can all fit in. Anyway, but because Lake County has been hit so particularly hard economically around unemployment, and then also the impact from the surrounding counties because they were hotspots, COVID hotspots, and then also with the reduction in the climax workforce, I think that poises us in a place to pursue all the funding, COVID specific funds that we can, that in a normal economic downturn might not be there. Were it just a statewide impact, I think we need to look at what we can get out of that. Everything from CARES Act money that's coming to local community governments. I'm trying to get more disaster TANF money. There's, I know there's some Main Street money out there. I know there's multiple things in different avenues. So it's looking at that, putting folks on it, determining what's worth our time, And then every grant you get and every piece of funding comes with administrative work. So that's the other thing to consider and look at. Is what's involved. And the FEMA PA, I feel like we have a pretty good handle on that. Mabel's been watching that a lot, and Crystal has been evaluating it in terms of our staffing time, our food purchases, other supplies. So we're working on that, and certainly going to be applying for everything that we can around that. But everything else that's out there, especially things for rural communities. Yeah, so that's a rough idea, very rough.
It sounds great. And
Sarah, do you have stuff to add to that?
No, not much. I mean, I think those resiliency pieces and those regional, that monitoring, there's a few other kind of broader topics that fit under those three categories you named, Janine, that kind of plug into all of them. And, I was laughing as Christy, you were saying the disaster rebuilding, we usually think about how to rebuild something, completely from scratch. And while I think a lot of us feel that there might be some areas that we may need, but I believe that, we need to get to that resiliency piece. And as Janine mentioned, the capacity piece, and really look at being pretty focused, if not conservative, about our efforts and aligning efforts. That's something that, I think we always, with community partners and as much as our community is involved and has amazing partners and organizations, I think that conversation to really focus efficiencies and efforts will be really helpful.
Yeah, well, that's great. You guys have a meeting this week. If there's something that comes out of that, Janine, if there's something that you need, let me know. We have Kate Guibert, who is our rural prosperity manager, that is really been taking the lead on rural futures and adaptation and gathering best practices. So we are trying very hard to manage all of the resources and put them in one place. So we're working on a recovery website through the Resiliency Office that we're hoping will help manage the information. So we are working on it. I know there's so much. Mike and I were trying to, the last couple of slides here in the presentation, Mike and I were just trying to put resources on it, and it was getting out of control. So I understand obviously where you're coming from. So I think it's a great start. So hopefully we can help you as you move forward. So at that meeting on Thursday, it might be, this slide in particular might help a little bit of you coordinating that that meeting and keeping everybody kind of on task. So some things that you might think about at that meeting, what's our vision for our community as we come out of this? What values do we have right now that we want to ensure move forward, that we don't want to change in the recovery process? Are there pressing issues that our community is facing that we need to make sure we're taking into consideration? So, Climax Mine, that's like a double whammy for you guys. So how do we make sure that we're thinking about that as well as we move forward in this recovery effort? What resources are available that will help us achieve our vision? Making sure that those connections stay strong between the locals and the state. And, I offer myself up as that point person and liaison for you all to keep that moving forward. And then we want to, really empowering the community. We note that the, government, the county government is potentially the lead to kind of kick off this recovery, but how do we make sure that we're engaging with, our nonprofits, faith-based community, and all of those others that really bring that community together, engaging CMC, your Main Street program, that kind of thing. but it sounds like you have a fabulous handle on all of that. All right, so as you move forward, I usually start the presentation off with just thinking about, we're still in a response mode, right? Our public health, our emergency managers are still responding to this event. Our first responders are still out there, and our hospitals are still engaged in a response mode, even as we are thinking in some ways about looking at recovery. But something to think about is how the impacts of relaxing social distancing may change the way your recovery plan is written, or in making sure that we're thinking about these impacts as we write our recovery plan. So as people head out and into the community, a second peak of infections could arise as well. So how are we engaging with our hospital to make sure that we are keeping in mind their capacity as we move into recovery, wearing masks, increased testing, hopefully that will slow the spread down. So as elected officials are figuring out, how to kind of transition into phases of reopening, thinking about what other health concerns we might need to be taking into consideration as well. So just something to be thinking about as we're thinking about recovery, that we need to be also thinking about a second wave of needing to respond. So as we think about recovery in different ways, a good tool or exercise for you all to think about going through is really scenario planning. So we think about issues and opportunities within different scenarios as we move through into the future, right? We can't predict how things are going to unfold. We are hoping and wishing, and we're going to do what we can to hope that it's successful and our businesses can reopen, but we need to think about those future possibilities that we don't know and how we can be planning for action so that when that future gets to us, we've already thought about it. We already have a plan in place for implementing different things so that we're not making those decisions in the heat of the moment. So looking at different scenarios, and I have a couple examples. So looking at different scenarios and what are some issues and opportunities that need to be considered, defining what strategies could be in place to address an issue or take advantage of an opportunity, looking at state and local guidance and turning those into actionable tasks that then may require staff time or equipment or materials. So making sure that we are thinking about the operating side of government as well, right? We're focused on business. We want our economy up and running again, but there are a lot of governmental activities that need to be taken into consideration as well. So, all right, so if we transitioning into open over the next couple of months into more and more open businesses, you can think of kind of three different scenarios, right? There's control of the virus, we are keeping our community safe, and we don't see a spike in any more cases, and so everybody's doing good and moving down the line. There might be a resurgence of the virus, and so we open things up and then we might have to put restrictions back in place. So what does that do to our community, both in a capacity of behavioral health, mental health, people feeling good about things, and then having to go back into this shelter in place, and what does it do to our business community as well? So there also might be some delays in relaxing some of the restrictions that are in place right now, through the summer or into the fall. What might that look like as well? So if we just look at in controlling the virus, a few issues that we may define within this scenario. Are people being wary of being in public, not wanting to be out and about very much, not wanting to utilize parks or open space? Maybe there's less tourism in the near future. Might we need to think about what our civic infrastructure looks like? So how people get into our courthouse, our city hall, our recreation centers are we providing the same level of service that we would like to? There might be some opportunities as well. So if we can capitalize on what other communities are doing. So I've seen where people might be closing down Main Street to vehicular traffic, and it's a big open mall, so that restaurants can kind of spill out onto Main Street, and there's more space for them to open up and serve more people. Maybe our community feels more united, and we're kind of in this together, and so we're going to get through it together. So,
Christy,
yeah,
I got a quick question. I have been curious about specifically setting up, we have the health and safety category, and we do have some resources for folks, but I'm wondering specifically about setting up kind of a response team for folks in quarantine moving through this, and or by that, not only meaning people who are showing symptoms or are falling ill, but possibly including, senior citizens or more susceptible folks who are worried and who are part of the population who, are reaching out, demanding that we do more and close things down completely. I had seen, setting up something specifically for them, and maybe that's already happening actually, and I just don't know about it here yet. But delivery. I mean, I know we're doing deliveries for seniors and folks similar to Meals on Wheels, and have expanded that a bit. Are other communities doing that to kind of compensate for that attempt to open up the economy?
Right. So kind of taking some of the congregate places where those folks may have gathered before, and taking those services to them.
Yes. Right.
Yeah. So I've seen in a few communities where that has been kind of a priority for community members and engaging nonprofits. So like here in Salida, there's a group called Helping Hands that has been doing a lot of delivery to seniors, and some of it isn't even food delivery, or some of it's stuff that they need, right? Food or medication. But also I saw they delivered flowers on Friday for May Day to some of the folks on their list that they
Right.
work with. So I think it really is about what you guys have to determine what your capacity is, right? But finding those partners, whether it's through church groups or nonprofits that you already work with. I don't know if Build a Generation has, there's only so much capacity in a community overall, but I think that communities are finding, if you work together to figure out who you're serving so that people can kind of spread out that work. I don't know if
Yeah, I think
oh, go ahead, Janine.
we had a really robust disaster response to all of that, and it does feel like folks' needs are getting met. Anybody who's been quarantined that has a need, we've been collaborating on case management and getting them food and what that needs. I'm just so grateful, and I know my staff would get on me. My child welfare case managers are always like, do not say that, because then you're going to make it happen, you're going to jinx it. But we haven't had, maybe the intensity of health related case management issues to really have to function with. But I think the challenge is sustaining that. So we've had really good response, but what's it going to look like if we still have seniors or folks who can't leave their home 2 months from now or 3 months from now? That's what we have to plan for, is how can we have that sustained response to meet their needs, and what does that look like? Because people are really gung-ho when it starts. And then also just recognizing that the folks who coordinated that, that's not their main agency mission.
Yep. Yeah.
So we're going to have to figure out, are they going to have the capacity to continue doing that, organizing and coordinating, or do we have to share that in some way? Because that's what always happens. Churches want to become shelters and everybody wants to jump in, but
yeah, I don't know if it's, people get tired or they move on to something else. I'm not sure. That might be something that your government collaboration IGAs committee potentially could be looking at, is a scenario planning for keeping, responding to those within our communities that are vulnerable. Can you set up kind of a Gantt chart of who would be responsible in May, and then transitioning over the responsibility to another organization in June, so that people's resources, those organizational resources, aren't completely wiped out, and that people are doing what they need to do, but kind of the commitment is still going strong and still there. Okay. So there's a lot to think about as you move forward. So I'm glad that you have those subcommittees identified. All right. If there aren't any other questions about that, Mike's gonna talk about some funding and technical assistance available, and then we can have more of a conversation, questions after that. Mike.
Thank you, Christy. So I know Janine said that she was dialed into FEMA PA, and so I won't beat people over the head with this slide, but this is a really good visual of kind of the macro steps for FEMA PA. And just a reminder, the only category of public assistance is category B, which is emergency protective measures. It's just important to kind of keep that in the back of your head when you're looking for reimbursement of costs. Kind of as a metric is you should look at and think about being reimbursed for everything and plan your documentation accordingly, right? Because I haven't seen yet, despite me asking probably at least a dozen times, any type of guidance with Health and Human Services reimbursement. Yet I know that because that's what this declaration was originally declared on, right? It was an HHS declaration. And the good thing about that, that's 100% reimbursement versus 75% reimbursement. Yet I haven't seen any type of documentation. I will say that if you do your documentation like you would do for FEMA public assistance, you should be fine with HHS whenever they do come out with their guidance. So everybody should have seen the applicant briefing that Michael Haney provided. If someone was not able to see that, that is actually recorded. I've provided the YouTube link to Kaylee, as well as the slide set. And there's about 4 fact sheets that go with that as an augmentation that really provides you the basis for getting started with public assistance. Then the next step would be going to the FEMA website, creating a profile. I think that Crystal is still in the queue for getting that profile completed, unless someone can tell me that that's actually been acknowledged as being completed. I know that I talked to Kaylee about that recently. In any case, she'll get acknowledgement that profile is complete, and then she will do a form that takes 3 or 4 minutes, which is a request for public assistance. Once you get that done, next you're going to do project worksheets. And the good thing is Mabel is really well versed on project worksheets and more complicated ones than you're going to be submitting. FEMA has promised to streamline the project worksheet process, because remember, this, unlike the 2013 floods, where we were the only show in town, we being the 19 counties declared, this affects every state in the union. So there's no way that they want to go through that burdensome, long process. So they're trying to make those project worksheets as streamlined as possible for two reasons. One, they don't have the manpower to do those complicated sheets. Two, they want to get money out into locals' hands. It does no good to hold those up when local governments actually physically need that money. So that's kind of the glide path. The documents, which are complete closeout documents, Mabel's very familiar with that. She may have some choice words to say about how fun that is, but it is going to be, I hope she's not going to mock me, but I hope it's going to be better than last time. That will be faster. In any case, once those final documents are accepted by down in Texas, then checks will be cut and you'll be receiving funding. So that's kind of the overarching process for public assistance. But I'll pause now to ask if there's any questions before we move to the next slide. This one actually is closely. Any flowchart related questions? Okay, if we can go then. So this is your dedicated public assistant person out of the Office of Grants Management. And the reason why this is really important is because, as Mabel will attest, we being Lake County, cycled through so many FEMA folks, like, because they were on 90-day assignments. And so as soon as they figured out like what they were doing, they left. It got to the end of the time period and Mabel was like teaching them what to do, right? Because they just got assigned and they didn't know. And she would have to send documentation. This person here works out of DHSEM in the state of Colorado, and that will be your person from now until like 5 years from now. Like, there won't be changing out all these people. And I think that's going to be super helpful. That said, if people do have questions, that DR 4498, that is the designation for our disaster. And if you have questions, send them to them and that will go to the experts for them to answer. So next slide, please. Oh, well, there's like a little click thing there. So we talked about public assistance. I sent to Kaylee for both the sheriff as well as police chief. There is funding that is specific to law enforcement that could be used for PPE and some other varieties. There's very specific guidance on that. So that's an avenue that either the sheriff or the police chief could use for any of their requirements. And it might be quicker than doing FEMA PA for that. I think Christy talked about the USDA food assistance program. Mabel's already starting to work on that. So that process is in place, but that's a whole program. And if you go to the USDA site, there are no less than 20 different programs that you could apply for and use. Some of them are not applicable and that they're agricultural based. And as we all know, it's too cold to have anything like agriculture in Leadville, but there are quite a few that are useful. I will just say, and Christy can jump in and correct me if I'm wrong, but the community development block grants are under guidance. The guidance is being developed right now in that office for implementation.
Correct.
Is that a safe statement?
That is a safe statement, yes.
Perfect. Okay. And then the last item here, I also sent this out too. A lot of you are very, very familiar with the Assistant to Firefighter Grant Program. Well, this is a supplemental so that if Chief Daly wanted to apply for getting additional PPE or cover some additional costs, there's $100 million put there for those types of items. It's a supplemental. It's in addition to the normal grant process. And I'll let you change it because I guess I can't do that. And so here's some other type of opportunities. Christy suggested we use Carl Blueprint to End Hunger as kind of a large net for those types of programs for feeding. It's kind of a clearinghouse for that, and I think that's a good place to start. I definitely have written down for me to connect the Chafee Salida food banks with Mabel. There's also some rent assistance programs. If you go to this page here, it will give you some very specific guidance in that area. And the last one is access and functional needs. It goes under the acronym CMIST, but that's what most of you are familiar with access to functional needs. This is broken down. If you go to this specific Google Drive, it has a spreadsheet, and you can look on the spreadsheet for resources that you might need for folks who have, let's say, mobility issues or some type of specific impairment that you need to deal with in relation to COVID-19. Or it's also a good source, even if it wasn't COVID-19. And I think we got one more, right? Yeah, some additional resources. Did you want to say anything about SBA, Christy?
You know, every time I see that one, it's new information. So Choose Colorado Now and our partners at the Office of Economic Development and International Trade really have a handle on what's available for your business community. So definitely stay connected with them. I think your rural business opportunity contact is Kat out of Grand Junction. So if you don't know her, let me know and we'll make sure that you get connected.
Perfect. I see from the comments here that Crystal profile has been approved. So because the next thing you're going to do, and believe it or not, is 2 to 3 minutes to do a request for public assistance. That will be a quick process and automated. Hopefully you're not emailing me telling me that it's not. Like, you'd be the one person who wouldn't be fast, but it's 3 minutes supposedly. And then you can start working on project worksheets, and I would encourage you to do those. Reach out to Mercedes, make that link. I've already provided all the emergency managers virtual introduction to Mercedes, so if you were to contact her, she knows who you are. And what else? I will say this: I'm on a task force for feeding and homeless. It's the South Central Region VOAD. They have a lot of resources, and the South Central Region is actually, I think, one of the few regions that actually is meeting and is not searching for food. I know Mabel's on that call, but if other folks are needing resources, whether it's in the realm of food delivery, things like that, some of the things that Commissioner Mudge was talking about, that might be a way of solving that, is through that VOAD process. I think that does it for me. And then we've exceeded a little bit, but we can run over for questions that folks might have.
Yeah, I will stop sharing this. Kaylee, I will send out this. Sorry, I realized as we were talking about all of these links that you guys need this presentation. So I will get it to you so that you have the links available to you. And you know, one last thing, and we don't need to spend a lot of time on it, but I did have a conversation with Chris Fabian with Resource X today, and it sounds like Crystal and Kayla met with him to talk about your fiscal, potentially moving forward with the fiscal health modeling. And I think that's great. I think that will really help you as you think about scenario planning and you think about your organizational capacity to, you know, open up places, or, you know, what things will look like if the revenue's down, and it really will help you guys, I think, make really good decisions. So I'm very glad that you are working with Chris, and if there's some way that I can support you in that, please let me know. And I told him the same thing today. Excellent. Do you guys have any questions, or is there a next step that, we can get information for you, or something else that you need at the moment?
Thank you very much, Christy and Mike. I don't have any specific questions for you right now. I think it's just, we'll hopefully on the kind of upward trajectory of getting organized. One thing that may be an ongoing need for us is kind of that communications piece, although we are swiftly moving to getting a new website up, and hopefully we'll be able to kind of broadcast information and compile it in a more digestible format sooner than later. But I wonder, might give you a call offline about that.
Absolutely.
Any other questions? Go ahead, Janine.
Well, just any other creative solutions that you run across that communities are trying, rather than reinvent the wheel, like you talked about. What if we expanded, folks' capacity to have seating outdoors, to create the social distancing? I think building resiliency is going to be about businesses being able to pivot and being able to think differently, government being able to think differently, and rather than trying to start from scratch, if there's others who have done it, if there are models out there that are replicable, let's do that.
Sure.
I think of like Greensburg, Kansas, when they were hit
Sure.
by the tornado, they became a totally green rebuilt city. So it's that kind of thing that I think if you're out there hearing that, you could.
You got muted, Janine. Absolutely. And we're trying to figure out the best way to do that. Is it statewide webinars where, we invite everybody? We do it regionally so that you all are talking to each other in a format that, will, keep it flowing. But absolutely, there's a lot of great things that are happening right now. And, we're trying really hard to keep track of them. So we will continue to get that information out to everybody.
I'm curious about the making Main Street a pedestrian only. That's certainly up for a much more in-depth conversation and engagement with business owners, because I did ask a business owner that question actually in regards to the CDOT project, the resurfacing project that's planning on going on, because he actually commented that his thought was, he had prepared for a big hit because of that project, and kind of scaled down. And those kinds of projects really deter foot traffic. And I asked him, well, what if we, block off the street and have it as an event? And, and then it was a parking issue. And he's like, no, that doesn't work. But I think, there's all those cascading unintended consequences or thoughts with best intentions. And again, and as everybody I believe has been doing, integrating those folks that we're trying to help as much as possible to be sure that we're solving a problem that actually exists, and with a solution that really is being asked for.
Yeah.
But I'm curious about that. And kind of on a comic relief note, there was a presentation with OEdit that I watched, and a small farm, I think in Oregon, called Sweet Farm at sweetfarm.org. They are, and I was thinking for our local like 4-H and other folks, they're renting out goats to get on people's Zoom calls and like have, it's like hilarious. So, and they're booked. So as that's just kind of one very out of the box thought. And I know that's not, kind of the big picture recovery, but I thought that was
like
pretty
goat
amazing.
yoga.
Yeah.
Yeah.
It's like you get the goat in the box on the meeting.
Nice.
Yeah. But
yeah, I think we'd have to talk about how it could work for Leadville, considering it's a state highway.
Right.
Some of the, so if there's an opportunity to hit one of the perpendicular streets off of Main Street, I don't know. Have to think about
Yeah.
what that would look like.
And I don't know if you know, I wonder about the employees and the staffing being sourced for those projects this summer. I think that they're probably already, you know, the contractors already have kind of their crews set up, but I do intend to reach out to CDOT and see who those subcontractors are, and if they've been affected with numbers, you know, maybe we can get kind of an inventory of folks who are currently unemployed here who could do some of that work. But just trying to plug in places like that.
Yep, that's a good idea.
And I'm not implying we need to close down Highway 24. I was just saying that as an example of an idea that another community's done.
Oh yeah, no, I think it's a curiosity for sure to see if that could be helpful.
Well, as Christy said, you know, we don't view this as, you know, being one webinar and, you know, that's it. So as you're working through the process, let us know, like what kind of next steps, like what other pieces of information, or maybe even a specific, I don't want to say guest speaker, but, you know, maybe have them actually provide that information. And certainly I will look across some of our other rural jurisdictions that are in other regions to see how they're doing things. And if anything, even if it doesn't necessarily look like it fits, I can still provide it and you guys could maybe customize it to your environment. So.
Great.
Hey, Mike. As we're doing, you know, our SCR regional coordination calls, is there a point where this is, and I know that our regions overlap in weird ways for all of our different departments, but do you see a regional recovery coordination call happening? I don't know if it's with you or with Christy or kind of a mountain region, but just trying to kind of troubleshoot those.
Yeah, well, you know, we already have DOLA already sits on our weekly call, like tomorrow. So I don't know who Wednesday is for DOLA, but we already have somebody. And, you know, I would envision as we move forward in this, they will have a bigger and bigger chunk of the time as we look at economic and all the facets of recovery. But I also want to say, and, you know, I don't want to necessarily leave on a down note, but, you know, we're in the opening acts of this play, so to speak. We are, you know, we have several years to go. And so, you know, the response aspect will ebb and flow depending on surges, depending on other things. So we can't back the response off completely because we will still need to do certain things, whether it is, you know, re-invoke certain social distancing, whether it's ramp up alternate care facilities. That has to happen kind of concurrent to this long-term recovery as well. So it's a long answer to saying yes, we can certainly add more time period to the recovery aspect on the call that's already scheduled.
Yeah, and I think I'm looking for also making sure, you know, it's not really, at least for our call, it's Colleen and Josh and I who are on it, but I want to ensure that the other counties have their recovery leads and Janine, and that we're able to open that up a bit so we can all be on the same page. But thank you.
Kaylee, we've, you know, I know Janine's been having conversations with Human Services Directors with Summit, and, you know, we've had through CCI, we've had a conversation with the Mountain Region commissioners, and then some just regional calls together. But I think that's definitely part of that, like regional monitoring aspect of one of those three categories. So I think that's certainly the goal very shortly, to get, you know, those key people identified with Summit Eagle and Chaffee and Lake to
Yeah, I mean, we can
keep
absolutely,
checking in.
yeah, we can absolutely set something up if you want some assistance to help coordinate that. Greg Winkler is on the call right now, not to call him out, but he's the regional manager for Eagle and Summit. So, you know, if there's an opportunity for us to help coordinate that conversation, please let us know. Happy to do that. I know that it can be, it's the audience, right? So those SCR calls, happy to give updates there, but if we feel like the emergency managers and public health directors may not be the intended audience for all of the message, you know, we need other people, then we can, you know, make sure that we're doing something else. So that can absolutely happen. And regions are different, right? So the SCR that Mike runs has, you know, Lake is the top of the northernmost part of that, and it goes, you know, down into Colorado Springs. And so in some ways it might be difficult to think about recovery in that region. Mountain District meeting for CCI covers a really big area as well. So if recovery needs to be looked at a bit more focused, we can do that. We want to be able to bring that to you.
Yeah.
That's just my 2 cents, Mike. I don't know if you agree with that. But.
No, I agree completely. You know, so to kind of elaborate on that, El Paso County has Mike Schwab, who actually was the state recovery officer. So the prior state recovery officer is running, and they have an entire recovery shop. And I've been obviously participating in some of their webinars. You know, yes, we're all in the South Central region, but to Christy's point, it's in many cases it's better to group us in the mountain or mountain valley area, and also inclusive of Eagle and Summit because of our close relationship, because we provide, you know, labor and work and all that kind of stuff, as well as spend a lot of money over there too. So I could see that easily. I'm not sure what we'd call it from a regional perspective. All we need is a different region, since we've got, you know, pick your flavor of region and we've got it. But I think there'd be value in that just because of the economic linkages that you have.
Yeah, absolutely. And because Greg's on the call, I do want to mention too, and we've been starting to reach out to kind of figure out where the resources are to get this information. But if Summit and Eagle are, you know, have specific information on employers and Lake County employees regarding their employment, I'm sorry, the commuters coming from the county, that's one place that I'm not sure we have a great handle on, you know, it'd be great to understand who's continued to commute to Summit and Eagle by having essential jobs, who's been exempt, and what portion of the population, you know, are going to be going back and at what pace. And I know those are all hard questions to answer, but if the information and the data is being collected or it's out there in any fashion, it'd be helpful.
This is Greg. I haven't seen anything that would lead me to believe that data is being collected.
I mean, even in like large employers, you know, in Summit and Eagle and their engagement, their responsibilities, you know, yeah, just to know how many. I mean, we got unemployment information this morning, which was very helpful. I just throwing it out there.
Well, we know that about 1,700 people commute over the hill each day. I think, the numbers, I see different numbers. We know that 430 of them work at Copper Mountain, so those jobs aren't coming back until next fall. So it would be interesting to see an analysis, but I don't know how we'd get at it.
Mm-hmm. Commissioner Marcella? Commissioner Glenn?
Yes.
Hello. Any comments or insights on your conversations the other day, or seeing that it's 2:09? Do you want to?
No, I don't have any questions, but I definitely think kind of what you were saying about the data regionally being so important is like it's totally important. Reaching out to the folks at the summit stage, they were kind of surprised by our questioning of when we can expect service to come back, because a lot of our essential services happen to be in Silverthorne or Summit County. So those conversations are really important to have.
Yeah.
So I think we definitely need to keep a pulse on that through recovery for sure.
Yeah. And again, because Greg's on the call, Kayla, do you want to summarize that kind of surprising tidbit of information when you were talking to Bentley in Summit County?
Yeah, for Greg Lobby, is that
Greg Winkler?
Greg Winkler. Okay.
Yeah.
Greg. Yeah, so I was talking to Bentley, who is the assistant manager in Summit County, and asked, I had reached out to them to ask about the resumption of the Summit Stage service to Lake County residents, and to ask for, how this might impact our grant dollars, and if it's something that we would, what our credit looks like or expenditures will look like through or the end of March, April, and May, and asked about the time frame for that service to resume. They seemed surprised to know that Eco Transit had not stopped service to Lake County, and I said, we just kind of want to have a pulse on where we're at with, how folks get to essential services in Summit County, if they're referred there through Human Services, if they have medical care, whatever that looks like, or grocery shopping, people consider that an essential need, hardware stores, whatever that might be. And there was kind of a surprise that was like, what, wait, why would you come to Silverthorne for essentials? And it was just kind of, I felt like they were very caught off guard that they didn't have that knowledge of how much of our workforce made up their workforce, or I asked for clarification if we should assist with telling folks, if you're in Summit County and employed in Summit County and you're shopping in Summit County for your essentials, follow these protocols. It was, I don't know, just a surprise conversation, I guess.
Yeah, I think we're eager to get.
Okay.
Go ahead.
I don't know how I'm going to go about doing this, but I will at least make some phone calls and ask. What I sense you're trying to get to is, depending on how things open up in Summit and Eagle respectively, one, we're looking at, you are wanting to know how that is going to affect Lake County and the transportation of people between counties, and or just that your folks are now going back to work in Summit or to work in Eagle, and that could create a particular issue in the spread or non-spread of what we're dealing with.
Yeah, so I think that there was some conversation. So there was some conversation around, there was concern from the public health director in Summit County and the county manager in Summit around opening those lines of transportation to outlying communities to Summit County to limit the spread of COVID coming into Summit County. And so my question to them was, okay, but since the bus route has stopped, do you have an estimate of how many of those people on the bus route were considered essential employees and have been commuting in other ways? Or do you have an idea of how many people commute every day that have been considered essential? What does the traffic look like going to and from Lake and Summit County? And I don't know that there was any thought around that between both of us. And so I think maybe it's just something we might want to get on the same page about so that we have kind of expectations that are operating in tandem instead of in a perpendicular type of way, so that we're not telling people, some like Eagle County has gone into a safer at home model, so you can go over there and do all these things. Or we definitely don't want to be sending people in the wrong direction, but and be thoughtful and cognizant about what's happening over there, but also want to just have a similar united message to them that are commuting, if that makes any sense.
Yeah, has there been any attempt of conversations between you commissioners and the commissioners in Eagle and Summit?
So I've connected with the commissioners in Eagle and the commissioners in Summit, and I often have updates sent to me specifically from Eagle County. They're really good about sending updates at least once a week about things that are happening in Eagle. It's a little more difficult to be on Summit County's radar, but I think it's just because I'm still somewhat new in my role, and so don't have that relationship super developed at this point, but have managed to form that relationship in Eagle County, definitely.
Okay.
I think it was just the point of information of that, like you said, Greg, the transit piece means many commuters can get to work from Lake County. And so, we have a good relationship with Summit Stage to continue that discussion with them. And then two, that 70% of our population are commuting over to Eagle and Summit. And so when they do start going back to work, that is, increased exposure or transmission concern, and trying to monitor the ebb and flow of what impact that might have. And then just the point that, Summit County seemed to be surprised that folks were still heading over the hill to do what they were considering essential shopping and purchasing into Summit County. So
Okay.
we've got the conversation started, I think.
All right, well, I'll see what I can do.
Thank
Thanks.
you.
Any other questions for everybody? For the guests of honor here or otherwise? It doesn't look like it.
Well, thanks for your time today.
Thank you, Christy. Yeah. Thank you very much.
We will stay in touch. I'm going to jump on another call.
Very good.
We'll see you guys later.
All right.
All
Thank
right.
you, guys.
Bye-bye.
Y'all have my email if you need to ask something. So don't
Yeah,
miss
and
out.
Kaylee, I sent a presentation to you. If you can just send it out to everybody, I would appreciate it.
Yeah, absolutely. I just got it and sent it to the board to send out to directors and elected officials.
Excellent. Thank you.
Thank you.
Perfect. Thank you.
Bye.
Thank
Bye.
you.
Anything else from the commissioners?
No.
Nothing new.
Okay.
Thanks.
All right. Take care.
Bye.